Hey, everybody. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me one of my dear friends and he's one of the rare bird speakers, Dr. Lou Kaufman. Lou, thank you for being on today.
Oh, pleasure to be here. Thanks for having me.
Yeah, what I love about Lou, I mean, he's an amazing speaker. And Lou, I have just, since I've gotten to know you, you're just a warm human and you're just warm, you're authentic, and you're an amazing speaker. So I wanted everyone to hear your story. So Lou, we always start out with why dentistry for you? What drew you to it?
Wow, great question. What drew me to dentistry? I didn't start in dentistry, as you know, Kelly.
Mhm.
I started in the restaurant business. I got a degree in marketing, finance. I got an MBA in computer science, executive management, which seems like eternity ago. And I did that business for a few years, and I was like, I do not want to do this with the rest of my life. So I said, I wanted to help people. I wanted to use my hands, wanted to use my brains. So I looked at medical and dental. And medical, I did the math. I figured I'd want to go into surgery. And that would have just taken way too long. I was like 26, 27 at the time, and I didn't want to finish up when I was like 42. And I looked at dentistry because my dad was a dentist, but I didn't talk to him. I talked to everybody but him. I
Really?
made a decision. I talked to some of the colleagues I knew of his, got their opinion, went and toured University of Illinois, where I wound up going, College of Dentistry, and then I pulled the trigger. I had to go back to school and took all my requirements for dental school, and thankfully I got in. And the story of me in dental school, I mean, is another topic because I did repeat my first year of dental school. I won't go down that road right now, but it was all for the better, all for the best. And if you asked me back then why, that I would be speaking, if you will, and teaching others and lecturing and doing what I do, I would have said, nah, I just want to just be clinical. I mean, I love dentistry. It's just an awesome profession. It
It
turned out to
is.
be a great choice. I have no regrets looking back and changing careers at 27.
So did you ever talk to your dad about dentistry?
Yeah, eventually I did. I
What
sold
did he say?
he had a big ass smile, excuse my language. Just, I mean, he just grinned and uh, could have been probably a choice comment knowing him, like about time or something like that. Yeah, yeah, he was thrilled. He was thrilled. And it's funny, recently I saw some old photos of when I graduated dental school. And my dad is since he's deceased now. I had a nice long life. But the smile and how proud he looked, and as a father myself, I can't even imagine how rewarding that was for him.
Yeah, it's always so surreal as a parent when you think back to how your parents were and what was going on in your life to think, "Oh my gosh, that's how they felt about me at that time. That could have been how they felt."
Yeah, yeah, yeah. And it was warm. So yeah, he was really pleased. Fortunately, we got to practice together for 15 years before he stopped practicing.
Yeah. All right, so I do wanna ask a question about your first year repeat if it's not too
It's fine.
okay.
Go for it.
What did you learn about yourself repeating that first year?
I learned that you got to dig in. I've always been somebody who's dug in, who doesn't accept no i- i- as a decision. There's always a way, but fortunately, the dean of the dental school and all these heads of departments, they gave me the opportunity.
Mm,
You know, after I was brought into a conference room during about 2/3 of the way through my first year of dental school. I was told that, and I'm giving you like a high level view, not the
sure, yeah.
exact details. And they went around the room. They gave their feedback on my performance, how I was doing, what I needed to work on. So they didn't, I wasn't strong in the sciences because I had that Bachelor of Arts. I had to take a year of sciences before I applied to dental school. But I learned really, just about buckling down, and it's hard work. And I knew that, and I knew I had the mental capacity, the amplitude, the bandwidth to excel and to succeed. So yeah, I mean, I've always been a grinder, always, no matter what I did.
Yeah. So you You went back, you repeated, you dug in, you persevered, and what would you tell someone who is maybe in that same situation? Because I remember when I was teaching at Virginia Commonwealth University, there were and in the years that I'd been teaching, there's some people, that just have to repeat things. They need remediation in certain courses, and at the time when you're going through that, it feels like your world is ending, right? It feels like it's just crashing, but really it's all for us. So what would you tell someone in that position who may be experiencing that?
If a person is experiencing, second doubting thoughts, if you will, of I can't do this. I was you gotta look at the bigger you gotta look at the big picture. What are you excelling at and what do you need to work on? And if somebody's giving you an opportunity to do better, you got to take it because you are in a profession in dentistry where the learning never stops.
Yeah.
The continuing education is constant. I mean, they taught us that in dental school. Read journals, do your research, look at the research, where it's from, who's offering it, um, because that is a responsibility of a doctor, a professional. You are a teacher just by definition. When you have a doctorate, you can go teach others. So uh, you have to persevere and look at, hey, what do I need to work on? And I'd say you just gotta buckle up and put in the time. Look at how hard it was to get into dental school, how hard it is now to get into dental school. There's much
Yeah.
more applicants. It's much more competitive. Um, and you got in. You're the best of the best of getting in. You have the mental capacity to absorb this information and repeat it. And you have to tune out all the other distractions around you in your life. And
Yeah.
I was fortunate that I could do that. I didn't have kids at the time. I wasn't married. I just kind of I worked and I went to dental school. That was it.
Yeah, I found it to be that in those challenging times where it was a crossroad, is that I always had to ask myself, "Why did I start this to begin with? Is this really what I love? Do I still love it? Is this worth my energy?" I mean, going to school to get my PhD, I had to figure out what I wanted to study for the next 5 to 7 years, and I knew that it was people, I knew it was leadership, I knew that it was communication, bringing people towards a similar goal, so no different in any other focus area of focus, is that if you believe in that and that's what your heart wants, it's worth it. And like you said, like, people gave you another chance. They saw something in you to say, "Hey, Lou, have another go."
Excuse me. Yeah. Thank you. Yeah. It's interesting. A lot of my patients are from the University of Chicago. So I have a lot of students, professors, et cetera, and from all over the world. And I had a young man in 2 days ago from Australia. And I said, "What are you doing?" It was a PhD program. I can't remember in what, but it was like like a 5 to 7 year program.
Yeah.
It's like, yeah, I have to buckle up for the next 5 years. Physics. It was physics. That was it.
Oh, wow.
So it's having that mindset. Why, like you said, why did I get into it? Why am I changing this path? Why am I pursuing it? And what opportunities can lie ahead for you?
Yeah. And I think that every time also that we prove it to ourselves that we can do it, so, like, when you got through that 1st year, you're like, "Okay, I just did it. If I can." So, if you can get through dental school, if I can get through hygiene school, we can do anything, right? I mean,
Absolutely.
because once you said it like that, it's just, the universe is the limit. It's not even the sky. It's whatever you that we tell ourselves we can or we can't. So you have, I mean, your career has taken you some cool places. Where did you graduate and go, were you an associate? Did you buy your practice? What did you do after you graduated?
So it was really cool. When I graduated, I was asked to work in the special needs clinic at the University of Illinois College of Dentistry. And I said, sure, I can give you 1 day a week. The other 5 days, so I was practicing with my father. I had that opportunity. I mean, obviously being a little kid growing up over the years and being a part of a dental family, if you will, or a dental practice, that was a natural stepping stone for me. And I got to say, the last couple of years of dental school, I mean, my credits were just, I was done early. So I spent a lot of extra time in oral surgery, a lot of extra time at perio. And I had mentors in those departments that, said, hey, if you got a case, bring it. We'll do it. We'll over the shoulder you to do the case. Or I just hang out in oral surgery and waited for, somebody to give me something to do. Uh, so I never felt the need to go do a residency um, in after I graduated dental school.
Makes sense. Yeah, it makes sense why, yeah, you had that opportunity, that gift
Yeah,
that
I mean,
gave to you on the back end, right?
yeah, I had like most of my crown and bridge was done like just before the middle of the fourth year of dental school, and
Wow.
there was a lot more credits that you needed back then. I can't remember the total amount, but you had to start giving them to your classmates or the year that was behind you so they could start accumulating their credits as well.
So what happened after that? Like, there's a span of time because you obviously love what you do. You go out and you teach everywhere about it. So, how did you well, I guess that span of time, because I'm sure you'll tell the story, but how did you discover what you love so much today?
Y you know, the I was fortunate. Some of this was by chance for sure. I, when luminaires became big, veneers, that's Denmat for anybody who doesn't know. Denmat, is no longer, it's now clinician's choice, and, there's another lab called Robertson, Labs that are doing those veneers. I mean, luminaires was a brand, but this had to be, so I've been lecturing about 18, 19 years, it seems. Maybe 20 years ago, I got turned on to Serenade, so minimally invasive veneers. And I was like, wow, this is really cool. I don't have to destroy all this tooth structure. I can do minimal prep. Let me see what that's about. And I started pursuing the aesthetic side. And I was like, patients were really loving it. I was like, this is really cool. The results. So I attended courses out in California with Bob Ibsen, who was the founder of Denmat. And I was like, gosh, I've always wanted to lecture. And then introductions were made um, from a good friend of mine to the head of like education at Denmat. And because of the relationship I had with this woman, she had introduced me, as I said, to some of the leads at Denmat.
Cool.
And they said, okay, you want to give a lecture? I said, sure. I didn't know what I was getting into.
That's what I'm
So
just
yeah, yeah.
waiting for it.
And they said, we want you to give a lecture. And at the time, it was called the Luminaire Smile Discovery Program and how it impacted your practice and what it's done for you. And I only been doing it for the LSDP program for like 6 months. Back in the day, Denmat used to have these huge continuing eds in Las Vegas once a year, thousands of docs, big. I mean, it was the event of the year. I mean, this is before DS World and all the other stuff you see going on now. They said you have, I think, maybe 10 minutes. I remember, you know, building everything and getting on that podium for the first time and looking out at this crowd of probably 1,500 people, maybe 2,000. And all I felt was my throat go dry, my mouth go dry. I looked at the guy who worked for them at the time. His name is Rob Bernizer. You probably know Rob. He's with Glidewell now. I said, I need water. I'm just like, yeah, got me some water. I took a
You
sip.
literally got choked up.
I mean, I was drier than dry. And then before I knew it, I was just flowing into the presentation. I speak from the heart. I do rehearse, I do practice before I'm going to go give a lecture, um, more today than I did then. But I always know the path I want to go and what I
Yeah.
want to share. So I give this, it's 10 minutes. I'm like, I thought it was great. Got some applause. I couldn't get off that podium fast enough. I was like, I was done. I said, telling myself this was horrible. It's the worst decision I've made. I think awful. And I get down to where people are that know me. Like, great job. It was wonderful. And I'm like, okay, great. Just I just wanted to leave. I just wanted to go hide in a corner. Later that day, I find out that Dr. Ibsen wanted me to fly to Santa Maria, California to meet with him in a couple weeks. So I went out there, met with people at DenMat, and then went out to dinner with Dr. Ibsen, his wife, Rob Bernizzi, and some other people, and had a great dinner, great time, good conversation. Um, I was like purposely parked next to Mrs. Ibsen. I don't know if that was pre-planned or if I was getting interviewed or getting her blessing. I wasn't sure. The next thing I know it, I was told, they want you to be a lecturer, a speaker. They want you to teach for Dr. Ibsen for DenMat.
That's so
And
cool.
and at that time, once we started rock, I had to go attend a couple other lectures and listen to how they presented what they were covering at the time.
Mhm.
And next thing I know, every other weekend I was on the road teaching minimally invasive courses on smile design, veneers. And in those days, you didn't have CAD or any of that. I mean, you were using stone models and pencils, explaining how everything was done. Uh, we had hand pieces at some courses. We're teaching restorative. We're teaching the veneers. Um, all of that, I'm sharing business ideas and business side. And because of that start with DenMat, I met all these different people in the industry. It just kind of was just organic. Um, and when I got into cone beam and three-dimensional imaging, I was like, wow, I really love this. This is the future. And I started with that like 14 years ago.
Mm.
And that just blossomed. I mean, they were asking me to do lectures. I was doing lectures for Henry Schein. So it was like all of a sudden things started rolling and it's nothing I planned on. It just kind of happened.
Yeah.
Um, and I was able to document a lot of beautiful cases. I do my veneers a little bit differently now than I did, obviously 25 years ago. Uh, but that's how I got the start. Kind of a long-winded answer to your question.
No, no, it's, because I find it fascinating, some people we all get burnt out in our vocation, right? I mean, at some point or another, it's because we're life and all the things are on us at the same time. But I find that the best kind of kryptonite for burnout is learning something new. Right, and that's exactly what you did. It's just a little something, a different technique, a different shade to use, a different composite. For me, different scalar, different ultrasonic, and I'm like, "Whoa, wait a minute, this makes a big difference." And once you believe in that and you see the difference that it can make, I just feel like almost I don't know, I just feel like I need to tell people about it, evangelize it or
Yeah.
something. And I don't know if that was the same for you because you started using it, you're like, "Whoa, this is life-changing for the patient." And you could see also how it was life-changing for the practitioner. So that little decision that you made to step out of your comfort zone to learn something that took that extra energy, it went a long way.
Yeah, it's so true, Kelly. When you step out of comfort zone, whether it's in the dental field or your personal life, and you make changes, take on a new sport, excuse me, it it challenges you, and that's so good for the mind. It's so good to stimulate yourself that way.
Mhm. Yeah, it's necessary for growth, but that led you if you think about it, it's like the breadcrumb that led you down that trail to say, "Okay, first it was Lumineers," and you were like, "Okay, let me try the CBCT, let me do that. Okay, now that's really cool." That opened up a whole other field, and Lou, there's not a lot of people who can say that they've been using cone beam for as long as you have.
For a general, that's true.
For a
That's true.
general, right, and so the opportunity that you could literally see things that no one else could.
It was. I mean, obviously, and those that have combing know it opens up a whole new world. And I remember at one of these events, it was done, man. It might have been the same day no, it wasn't. It was another lecture I gave there. I said to somebody who was well known in the industry that I was going to purchase a cone beam, and I'm not going to say any names. And he said, "Why would you do that? That's just crazy. General dentist doesn't need a cone beam in his practice." And I said to him, "I respectfully disagree with you." I said, "Orthopedics, surgeons, they take CTs, they take MRIs, they want to see what's going on before they put somebody under, put a scalpel on them."
Yeah.
I said, "Doesn't it make sense that dentistry should be doing the same if we can diagnose better with it?" I mean, I kind of just saw that intuitively. So that's been, that's been a game changer.
Yeah, so how has your practice evolved
Oh
throughout
my God.
time?
Wow. Yeah, I mean, gone from mixing PVS by hand, if you will.
Well, yeah, even, like, the way that you practice, because I know that, you're with Smile Source now, and talk to us about how that kinda came to be, if you don't mind me asking, because I 'cause I'm learning from you.
Absolutely. So first I'll talk about the practice, and then I'll talk about Smile Source. The practice has gone from cone beam in office milling that we're doing. I haven't gotten into the 3D printing yet. I mean, I love it. I think it's wonderful. I think it's evolved so much in the last few years, and I'm close to making the switch, if you will, to that. Soft tissue management programs. We started instituting that about 12 years ago.
Okay.
Um, that's evolved using diode lasers in the practice for treating, for perio. Uh, you know, items like Perio Protect, bringing that in. So 10 years ago, I was approached again by a connection that came out of Denmat at one time about this company called Smile Source, and I'm like, well, what is it? And Smile Source is a group of like-minded, independent practitioners. Everybody owns their own practice. Everybody makes the final decisions in your practice. Nobody owns you. And their offices throughout the entire country. I think we're around 750 right now. So, and about 15, maybe 12, 1,500 dentists. And when I joined 10 years ago, I think my office number was like 212. So it continues to grow, and has grown organically. It's grown through, sharing that information uh, with colleagues and other dentists. What we get from this is great learning experience, great continuing education. We have the exchange every year. That's coming up in September. I think it's around the 9th through the 13th, something
Mhm.
around that. I don't know exactly that date. And everybody comes together, continuing education. You have vendors from around the industry. Um, so, yeah, you do get the group buying power from all of it. You get the camaraderie, you get community. I can get on a phone with, docs from all over the country. And if I need like patients moving to, say, Atlanta, moving to LA, Philadelphia, I know a colleague in those areas. And I say, hey, who should they see in that town? Um, the dentists involved with Smile Source, everybody's accelerating in their learning. They're always going to continuing education. Some of the best of the best. We got some really, some top people in the industry are a part of it. How it impacted and I brought my team to the exchange every year. How it's impacted my practice is been able to, save better on materials, goods. Um, I've been able to put better systems in place,
Mm,
better scheduling, better hiring, better better decision making as well.
mhm.
So that's directly impacted. I mean, in terms of how I run my practice, because you learn so much from everybody.
Yeah, it's a as a solo practitioner, as a business owner, we'll just say as a business owner, it can be so lonely because you feel like you're making these unilateral decisions. You feel like you're making it for the greater good of the group, and you don't have anybody to talk to. It's lonely.
Oh my gosh, yeah, for sure, for sure, for sure. The fact that um, you can reach out to practitioners who've practiced longer than me, business owners who've owned a practice longer than myself, and get their feedback and understanding. or they've been through the same thing you're going through. That's powerful.
Yeah.
And no judgment. Nobody's getting judged. I mean, we have our own forums on Smile Source, et cetera. I never see a bad word spoken about anybody. If
Mm.
you need an answer to something, you get it. If you have a case question, you can get it.
Wow.
Once a week, it's like 3 times a month now. We started out of COVID as a fireside chat from Smile Source. That's hosted by Dr. Michael Maroon, and he does a terrific job. He brings vendors on, or sometimes we just have, we've shared cases. We share information about what's
That's
going on
cool.
in our practices. That's powerful.
Sounds like a great community.
Oh, I mean, I've made some really good friends and colleagues from Smile Source.
Yeah. Awesome.
Yeah.
So, what would you say, Lou, throughout your transition, having throughout your lifetime? I mean, you've seen a lot, you have a lot of different perspective on the places that you've been, that you've worked, that you've spoken to, all the people that you've met. What are like maybe the top three recommendations you would make to the average dentist right now who is practicing, maybe um, who is looking for some advice, maybe struggling with keeping team or, finding time to go to a CE. I don't know. What are some things that come to mind?
Time is the biggest one. And because it can turn into a hamster wheel working and running in dental practice. It becomes very nonstop. You have to pre-plan your time off, meaning you need to block your calendar. And whether that's going to be 6 months, 12 months at a time, you have to block the time for you. And it's not just you. If you're married, you have significant others, kids, you have to make time for that personal life. None of this being out here where we are right now, present, it's not a dress rehearsal. Tomorrow's not guaranteed to any of us.
Right.
We have to plan out taking the time off. So that's my biggest advice. The second one is continuing education. You cannot do it all. Everybody, I mean, people have said this before me, they'll say it after me. You can only learn so much online. You learn so much more in person.
You do.
And maybe it's not from the lecturer. Maybe it's from people you're sitting with at lunch,
That's right.
talking to beforehand at breakfast. I have learned so much from my colleagues that I'm presenting to, that I'm lecturing to. Or if I accumulated all that over the years, I've never walked away from a lecture not learning something.
I know it's when the teacher becomes a student, right?
Yeah, yeah, exactly, exactly, and that's awesome. So in person learning. The third, join the AGD. I believe strongly in organized dentistry. I strongly believe in the American Dental Association. They have great continuing education as well. But the AGD, uh, their educational platform, go after that fellowship. That influenced me a lot. I'm slowly been knocking away at the master's uh, program as well, 'cause I really like to achieve that. I don't know when that will happen, but you have to set goals like that. So um, those are my top three um, that I would give.
Those are great ones. Those are, yeah. I think that those resonate no matter where you are in your career.
Yeah, yeah, for sure, for sure. You have to.
Yeah. Thank you for sharing your story. And you guys, Lou speaks, and if you want to, you can visit his entire speaker packet on his website, lukehelfmanspeaks.com, or you can go to rarebirdspeakers.com and go underneath our speakers, and he's on there. Catch him out on the circuit. He's an amazing speaker and definitely knows his stuff. He's been doing this for a long time, not to age you, but say like you got a lot of experience. You were adopting things way before anybody else was.
Yeah, that's true. And I'm not such a youngster. I mean, but I appreciate you saying I'm not old.
No, I mean, none of us are. We're wise.
Yeah, yeah,
It's our level. We've leveled up.
exactly, exactly, exactly.
Well, thank you again. And to all my listeners, thank you so much for all that you do every day. And you know that I always ask the favor to go on over to Apple Podcasts to give the Dental Handoff a 5-star rating, please. And if you're watching this on YouTube, go ahead and press the subscribe button and like and share to the friends so the algorithm will recommend it to people who you know will like this as well. So until next time, my friends, Lou, thank you. And if you want to know more about Lou as well, his contact information is in the show notes and how to reach out to him to ask questions or for mentoring, because I know he's big on that. And we will see you guys next week. Thanks, Lou.
Thank you so much, Kelly. Appreciate it.
Take care.
You too. Thanks.